So it's just on record, and I will hand over to Adam and Sarah for their community of practice about the National Neighbourhood Health Implementation Programme. And I'll look in your chat for you, Adam, if any questions or
Yeah.
anything come in. So I'll be your eyes and your ears, and Sarah on your chat for you as well.
Brill. Thanks, Amy. So I'm going to start off by just giving a little bit of an overview and some background to the programme, and then Adam's going to pick up kind of more specifics about what we've been doing and then what we're going to be doing over the next few months. Apologies, I have to drop off for another meeting at 10, but Adam will take over if we're still talking by then. So great to see everybody. So we thought we'd just set a little bit of context. So in terms of who's involved, so I'm Sarah Everest-Ford. I'm a Programme Director with the Health and Care Partnership, and I'm also the place coach for the Neighbourhood programme. We've got Ekta, who I'm sure many of you know is a local GP, and she's the clinical lead for the programme. Then we've got Adam as the programme manager, and then Laura, who is the national coach who we get as part of being as part of the national programme. So in terms of the name, it's obviously quite long, so we've shortened it to NHIP for short. So that's what you'll hear me refer to it as for most of the presentation. So we're one of 43 places in the country that are taking part, and the national team are really clear that this is a large-scale transformation programme. It's not a project, it's not standalone. This is how the NHS is going to deliver health and care moving forward. So NHIP is jointly led by the Department of Health and Social Care and NHS England, and it combines a mixture of national learning and local action. So places like ours get to shape the model whilst benefiting and hearing about what's happening in other parts of the country. So the aim ultimately is to work together across organisations and with communities so more people live well, inequalities reduce and neighbourhoods become healthier places to live. So the programme aims to improve health outcomes by developing neighbourhood teams, people with the right skills, data, digital tools and physical spaces. And that includes the development of things like neighbourhood health centres, which I'll come on to in a little bit more detail shortly. I think it's really important to note that we're not starting from scratch. We're building on the really good work that's already happening across North East Links. And all the insights that we gather locally are being fed into the national team. So we're also influencing what's happening nationally as well. So you can move on to the next slide, Adam. Thank you. So just a little bit about how neighbourhood health can impact and make a difference for people and communities. So what we're aiming to do is free up time for GPs so that they can see the people who need to see them most. So that's making sure through integrated working that people are being seen and supported by a whole range of partners from across the system. We will be working towards having more community provision so that people only go into hospital when they absolutely need to. Focus on people with the greatest risk. So as part of this work, we've working with a cohort of people, and they're people who have multiple long-term conditions and are at risk of going into hospital or having a crisis of some kind. We want to support people to manage their own health needs more, so using things like digital tools, but not exclusively. And then really importantly, working together as one neighbourhood team. So this will help with reducing handoffs between services and things like people having to repeat their story lots of times. Next slide, please. Feels very COVID-like, doesn't it, when you go next slide, please? Yeah. Thanks, Adam. So the programme is bringing together a whole range of partners, communities, frontline teams, and what we're trying to do is have that real kind of practical focus. So improving health outcomes by working more closely together in a neighbourhood. So we've started with Meridian, and the reason we've started with Meridian is because they're the PCN area that we're happy to be part of the application that we put into the national team last year. So what we've got on screen at the moment, on the left-hand side is kind of the more practical kind of stuff that we're doing on a kind of a very frequent basis, daily or weekly. On the right-hand side is more kind of long-term enablers that cover the whole of North East Links. So what we've been doing in Meridian is we started with a weekly huddle, which we've just switched up to fortnightly, and that's just through kind of practical reasons. And this is where a group of people come together from across lots of different services, so general practice, community nursing, the voluntary sector, social care, and look at really practical ways to solve problems for a group of patients or people, and look at how they can work in a more kind of proactive preventative way. What's been really great, which Adam will come on to in a little bit more detail about it, is the support of the voluntary sector. So we've got Friendship at Home, Thrive, and a number of other different organisations that are supporting, which means we can start to have those kind of wider conversations with people about what's important to them, and not just looking at kind of what the medical problems are that need solving. So I'll just pick up a couple of bits from the right-hand side. So neighbourhood health centres. So this is where we want to bring different services into one space for communities to make it easier for them to access a whole range of different services. We're doing some work around workforce development, so focusing on integrated multidisciplinary neighbourhood teams that can deliver the neighbourhood model. And then we're exploring something that's a little bit different that we've not done on a large scale before, and that's looking at how we get investment from outside of North East Links from social financing. So moving away from the kind of traditional way that money flows down from NHS England through the Integrated Care Board down to local providers. But what additional funding can we get that will have that kind of social return on investment? So we're currently developing a business case that we can take to potential investors. And then lastly, but not least, is kind of data and digital. There's lots of work we're doing in terms of how we can get real-time data around people in the neighbourhood, and around digital. We've just become part of an NHS England pilot that Adam, I'm sure we'll talk a little bit more about. Do you want to move on to the next slide, please? So just thought it'd be quite useful to take the opportunity to talk to you a little bit about neighbourhood health centres, and we're hopefully we'll have time today to do a little bit of engagement with people that are on the call as well. So for those of you that don't know, neighbourhood health centres were quite a feature in the NHS 10-year plan, and they intend to be that kind of local multidisciplinary one-stop centre, bringing together a whole range of different services. So it could include, but not limited to, primary care, community services, things like diagnostics, so having local testing, urgent care, pharmacy, and wider wellbeing support and PCSE services, very much kind of being part of the community and at the heart of the community. And they should be designed so that people can access care and services much more closely to where they live, and also to be a space that facilitates that kind of integrated joined up working. We've got some really good primary care centre space across North East Links, but it isn't necessarily covers those things that I've described or conducive to kind of working in an integrated way. So they will range from, they can be fully virtual space or a full physical space, and somewhere in between. I think for us it'll be important that we have spaces that do both those things and that people can work in that hybrid way. So the national ambition that there's going to be 250 neighbourhood health centres across England, and the government are aiming for 100 by 2030. And they want the first wave to very much focus on the areas with the lowest healthy life expectancy, those areas with the greatest kind of inequalities, and where space can be refurbished rather than a new build, because obviously new builds do take quite a long time. It's quite a long lead-in time for new builds. And I think this this space for us will be really important in that kind of moving more people out of hospital and being cared for in the community and around our integrated neighbourhood team working. So as I said, we will be optimising space that can be repurposed first, and we want to improve things like utilisation and making sure we join up programmes of work and initiatives where we can, so thinking about mental health hubs and also Pride in Place that we've got in Grimsby and across other parts of North East Links like Immingham. I think it's important to note that this isn't just about kind of like designing a space that's fit for purpose. We need to make sure that it's very much aligned to kind of like the Integrated Care Board governance and direction of travel, how we've got a realistic revenue and community services in the space. And I think what's really important, and I think this is something we've learned from over the years, that integration is much more than co-location. So even if you design the best space in the world, if we don't look at kind of organisational development and how teams work together, we'll continue to just co-locate people and not move from kind of collaboration to integration. And then, of course, there's a few challenges that you would expect with kind of spaces and buildings. So how we get the best out of like shared rooms. We've currently got rooms that are just used for one single purpose and might be locked for half the week. We have single reception areas in our spaces. So how do we move away from single reception areas to spaces that are much more joined up? So there's a bit of a kind of a culture shift with some of that. And I think where we can move some of this forward is it really needs to be about co-producing with the communities and the local workforce. We could sit in a darkened room and design a space that we think's right or ticks the box of the NHS England guidance. But if it isn't a space that communities are going to use or staff want to work in, then that's pretty pointless. And things like having like local champions and looking at the spaces that we've already got and where we might get some quick wins is really key. And as I mentioned, hopefully we'll have a little bit of time at the end of the presentation for Adam to pick up some of the engagement with you, specifically on neighbourhood health centres. Next slide, please. Thank you. So yeah, the next couple of slides, I'm just going to touch on kind of like how we are going to be measuring to show impact. And one of, or as you can see, not just one of, but quite a lot of the kind of programme goals that are nationally set are very much long-term goals, like health inequalities are reduced. The one at the bottom is clearly not going to happen overnight. It takes years to shift inequalities. So Adam, do you want to just go on to the next slide? So kind of what we need to make sure that we do is along the way is measuring things that will show impact, not just kind of the longer term stuff. Because if we wait for that, we'll be waiting a very long time, albeit it's obviously really important because that's ultimately what we're trying to do. So some of the things that we're doing is we're tracking the patients, the people that are in our cohort, so we can show things like an individual level around impact on A&E attendances. We're surveying patients and staff, and that's really important to gain insight into their experience and how activated they are, so how motivated they are to change or to improve outcomes. And that's really important. So it's important that we have the kind of qualitative feedback as well as kind of like the hard numbers that obviously the national team in NHS England are interested in. So I'll hand over to Adam, who's going to talk a little bit more detail about some of the stuff that we have been doing and what our plans are for the next few months.
Thanks, Sarah. So there's a few slides that look like this moving forwards, which is good. So I thought a little bit of what's been done between when we started at the beginning of October to now would be useful to know. So in terms of programme setup and governance, there's been a lot of work done around obviously the leadership we need for the programme, what partners do we need to engage, how are we going to bring people together to be able to support the programme. So we have the Neighbourhood Health Delivery Group, which NHIP sits underneath as part of that for some of the governance structure. And you see some of the key people on that front slide today around who are supporting that and doing the work locally, but alongside our colleagues also on the call. So Amy and I have been working quite closely recently around the community engagement stuff, and I'll touch more on that as I go through this. We've had to establish everything around the reporting. What do we need to set up to kind of give us that baseline around what work we've done, and how do we look as a place as well in terms of some of that baseline data. So if one example of one of those is around the 360 collaborative behaviours assessment, that's really something we've sent out to a number of partners. People who are on this call today as well actually have filled that in. We'll have give their honest views around how we work integrated. What do they feel like in terms of being involved, thoughts and feelings around what that feels like as a place in North East Links. And I am pleased to say that was really positive in terms of that initial feedback that we got from that. So I'll come to some successes a little bit later. And that we'll review those. So that's just gone out again at the moment, to ask for that to be completed again by those people and others that have been involved. We've done a lot of work around kind of logic models. So that's kind of a tool used for us to really think about what's the end goal, but then kind of working backwards, how do we start to get to the point of what's the actual activities and what do we need in place to actually make that happen. So that's really been a useful tool to help think about how we move forwards with the NHIP programme. We've identified our first cohort, as Sarah mentioned. A little bit more detail on that. That's a cohort of people that are 60 plus from a group of practices, and then 30 plus for Open Door and Quayside, because a slight different demographic of people that use those two practices. And that's been mainly around those with long-term conditions that have attended A&E more than 5 times and are the risk of escalation or admission, so that we can really have a good cohort that we can focus on and support to bring together. We've developed a number of different plans around how we deliver this work, community engagement. We've developed our position statements and other work that's going on as well. Moving on to communication engagement and kind of that co-production piece. This is where we're really, I think, really lucky, but also it's great in North East Links that we have such good engagement from all of you on the call and partners across the place, and willing to get stuck in and do some great work. We've just actually developed a bit of a community engagement plan that Amy, I and Sarah have worked through, and we've shared with our colleagues also at the local authority. And think about how do we really do that co-production piece well with services and community members around what does neighbourhood health look like, and also to support the neighbourhood health centres. And like I say, we've got time today. I'm definitely going to be asking a couple of questions of you on the call, so hopefully you don't mind that today. There's been the co-design of the huddles and the work that we've done there. We've done presentations to, including like ones like this, but to loads of people. Actually, I was looking at the list the other day, so there's quite a lot of people that we've engaged around NHIP and tried to bring that in at a local, regional and national level. And we'll continue to do that as we work through this. I think in terms of the neighbourhood delivery and integrated working, so we've launched the huddles. We're working through bit of a PDSA cycle approach to that. So really kind of flexing and adapting and changing as we need to and move forward. So we started weekly, we've actually moved to fortnightly, which works much better from all of our services engaging and being able to put the time in to contact and support patients. To do that around the tracker, and we've been able to look at those activation surveys. We've got Hector, as we mentioned on the first slide, is now working within the CUPT services to support a pilot around the community agent care teams and doing some of that crossover work within that. And there's been lots of discussions with other colleagues across the place to bring that in. I guess some of those enablers that support this work then have been around finance. So we keep talking about a left shift of funding options. So basically, what does that mean? Well, how are we going to think about what resources we have available, both financial and people, to do a shift so that we can support more people in our communities away from hospitals. And I think there's a whole piece of work to do around how we manage that. And I think I've seen some colleagues on the call. I can't see you all on the screen at the minute, but with our colleagues at Centre 4 and other areas around how we can scale up some of our work to make sure that it's supported well. There's bits of work around the workforce and making sure that our workforce is in a place to support the work that we do. That we've got some surveys that we send out regularly just to keep updated on what that feels like within the work, how engaged they feel, and how it's moving forwards. A number of other piece of work have been set up to support this. So there's an estates group, and as Sarah's already mentioned, around what does that look like across North East Links, particularly if we're talking about things like neighbourhood health centres, that we've created a plan to support that, and understanding if and what any monies or resources are needed to make those changes to make that happen. And then in the digital space, we've got our data sharing agreements across all of our partners so that we can work alongside each other for patient activity and improving health and wellbeing outcomes for people in North East Links. We've put an expression of interest in only a few weeks ago to explore becoming one of the 8 sites in the country to look at digital projects around co-design for I think that there was 7 areas, but the main one was around operational, I can't even say this word, interoperability. I think I've got that
right. Well done.
Yeah,
it's a horrible word.
I've been nervous about that word all morning. Basically what it means is to look at how our systems are supporting us locally to deliver neighbourhood health and support people effectively. A conversation we've been having here for since I've been in post in the health and care partnership is how do our systems work effectively together, so we're not duplicating work, duplicating reporting, duplicating systems, and we're recording information. And I do actually think that Ardle's a really good example way that people are able to access information and bring it together to support people effectively. So that's kind of what we've been doing up to now. What will our areas of focus? I'll just pick a couple of these out as we go through. So we're obviously redoing the 360 collaborative assessment at the minute. Next week we have Manal Bakai, who's the national lead for the NHIP programme, is coming to North East Links for the day to visit, to meet with colleagues and services and places, but understand what work we're doing around NHIP. And so we're quite excited for that piece and to understand how it's going on. And I'm hoping there's a bit of sharing from her as well around what's going on in other places and thoughts and feelings around how the NHIP programme is going across the country. In terms of that communication engagement, well, we said there's a bit of that co-production and work going on. So Amy and I only met on Monday, didn't we, Amy? We've planned some dates in the diary around getting to different community spaces, and we may be contacting some of you guys soon on the call to say if you've got some space where we can come in, but we really want to start to get the views of our community members and people around neighbourhood health centres, and I'm not going to talk through that too much because you're definitely going to be asked those questions in a short while. We're going to continue doing the work around engaging people around the NHIP programme and working with partners and engaging more partners where it's appropriate. I think what's important to say with this is that it's an ever evolving piece. It's quite fast paced. The way that we're working with this is we will try and include everybody as we can, but also bring people in absolutely as and when it is needed to. So we hope that all of you on the call are open to working around neighbourhood health as we move forwards. What we're doing around the neighbourhood delivery, so continuing the huddles, as I said, expanding that team, continue to work and develop that tracker and understand that patient person activation process. We're really keen that we're not just working with people and then that's it and we go, oh, that works really well. We want to understand what impact that's had on them, and also what impacts that had for our staff members and services that are involved as well. Has the process made it smoother, easier? Do you feel more integrated, etc.? And then a little bit more around some of the enablers and what we're doing next. So on the 5th of March, we have the national team coming over to do the digital co-design piece that I've just mentioned on the previous slide. And we'll start that work locally with a number of you that we've invited to come along to support that initial phase. And then we'll continue the work around linking that into the health and care passport that has been done through, excuse me, a colleague in Katrina Goodhand around mental health services, to support people and their health and well-being if they are taken into care or are being supported in the system, and how that might be digitised. And I think that will form part of our conversations over the coming weeks. A few successes and learnings and opportunities for us along the way. I think the fact that we've been able to put that dedicated group of people to support the project and the wider HCP team alongside our colleagues and the goodwill of all of you on the call to support this work has been essential. I don't think we'd have come as far as quickly as we have without everybody really engaging in it. So a kind of a thank you from us on that. And the continued support from the BCSE sector is absolutely essential if we're going to keep driving forwards and connecting with our colleagues. Our colleagues in the digital side and Sophie Hudson in particularly around the PHM tool and supporting us in terms of defining our cohort and supporting that work, I think has been really a success. The positiveness of the 360 assessment showed how our relationships, our collaboration across North East Links is already strong, and we're hoping that only improves as part of this process, and that improves even more across that kind of digital co-design work as well to remove some of those barriers for us in terms of how we access information. So what have been some of the barriers to this work, and some of these won't be a surprise to any, I don't think, but probably you see them in your own organisations as well, is that we've done this work and with no additional investment so far. The time and capacity, I mean, it's essentially become a full-time role, Sarah, hasn't it, for managing the NHIP programme. The moving goalposts nationally, I think that there's been an element to this around planning, and as the programme evolves and shapes and changes, and we feed back into that as well from all the different places across the country, that also changes sometimes the goalpost in terms of what nationally they start to look at or want to view. So we are having to be fairly flexible, but keep on our toes a little bit in terms of when we're doing the work locally. I think there's a little bit of clarity beyond March, which we really need to be able to focus on. There's a huge bit around delays in contracts and national contracts that impact locally around what they call single neighbourhood providers or multi-neighbourhood providers, and now that impacts our areas for GP practice, and then our boundaries in which we work in as well, and what do we mean by neighbourhoods will also impact how we do some of that work in North East Links. So at the minute they're talking about our neighbourhoods being based around natural communities of around 30 to 50,000 people. Well, we already have our PCNs in place, but we have other boundaries within North East Links, for example, school footprints, ward boundaries, etc. We actually have our own areas of East Marsh, West Marsh, Immingham, which have their own communities as well. So I think there's some interesting challenges and barriers around that as we move forwards. And I think one of the biggest ones to think about here is around that scaling within our existing resources, and that's something for all of us to think about. In a time where things are already very busy and our services are under extreme demand, I think that the potential that they will only get bigger. So how we scale within that is something that we all have to think about very carefully, and bringing into that the left shift around resources management and how we do that for the future. So what have we learnt? Well, this is obviously a long game. You saw on one of the slides says reduced health inequalities, but actually there are some quick wins that we can get from this in terms of patient experience, staff experience, systems, processes, the way that we work together. I think are really, really positive quick wins. But actually some of the long game around reducing health inequalities, some of the systems work that we might do for the future that will really, if you like, create that foundation for positive ways of working. We have to keep pushing that on. The relationships and trust bit for me has been absolutely key. We have some really strong relationships and good trust across the place. Do we always get everything right, perfect first time? I don't think so, but that's our endeavour to try and do that as the best that we can. But I think together we are working really positively on this piece of work, and that's really exciting, and it feels safe, I would say, is the right word in that between our partners. What have we found out also? The workforce is tired and dedicated at the same time. I think there's always something new and there's always something else to do. what we really want to think about in terms of anything around neighbourhood health moving forward is it becomes a way of working in the future, and not necessarily another thing to do. It's how we work with around our roles to improve the health and well-being of people in North East Links. A little bit I put in about the huddles. I think it's important we just recognise that mental health comorbidity as well as physical health is frequent amongst the people that we're supporting. So we mentioned the huddles. We bring 5 patients per week to the fortnightly huddle to support and look at across the system. So our colleagues from Friendship at Home, Thrive, social prescribing, mental health services, etc., primary care, secondary care are in the room, and we support those people as best we can to understand what their needs are. I think what it is showing is that the mental health comorbidity is frequent and high amongst those people with complex lives, and that their lives are complex not just from a care perspective, but actually socially as well, and what goes on for them. And one of the highlight parts that stands out in most of the people we speak to is loneliness and how they're connected, and what we've seen so far. And I'm sure lots of you guys that are on the call now and in your services see that as well. There's a huge reliance of informal carers. I think that we don't. Well, I think we probably do recognise it, but a lot of the times those informal carers also don't recognise it potentially or come forward. So it's something for us to think about. There's potentially always lots of services involved, yet people's needs not always being met. So there's a number of people we spoke about at the huddles where they're known to mental health services, they're known to social prescribing services, they're known to primary care, they're known to Friendship at Home, they're known to other services as well. Yet they still continue to present quite a lot at A&E or out of hours and other services as well. So it's understanding what is there around their needs that we can do that. And that some of these people are really very vulnerable, and I'm sure you guys come across people who are really vulnerable every day. But for me, it's just highlights to me that thought process around where are they touching people in the system, as in like which services, and then what are they expecting their needs from that? Because there has also been the other side to that where services are speaking in one way to one service and another way to another. So there's something for us to think about how they're doing that as well. What I would say is, and it's been working really well so far, is it's nice to look at it from the kind of what's the matter with you perspective, but more importantly, what matters to you perspective as well for these individuals. And that conversation that our colleagues at Friendship at Home or other services have had with them around what is it that's really important to your life at the minute has made a massive difference, and makes it much easier for us to support these people effectively. And then a couple of opportunities. So we're obviously going to continue to integrate, scale this up where we can, or think about how we scale this up and align that across North East Links. There's something to think about our neighbourhood health centres, and I'm sure many of you on this call have heard about the 24/7 mental health hubs as well as an approach. For me, there's something to think about how any neighbourhood health centre, how centres and facilities we've got in our VCSE sector at the minute, and colleagues and groups all work together within these to make it right for the communities in North East Lincolnshire. Then there's a huge amount of other programmes of work which I think we try to align to and best really take into account of the work that we're doing. For example, the Pride in Place work, or the fact that we are now Marmot Place within North East Links, I think is kind of absolutely key to supporting neighbourhood health work and the NHIP programme moving forwards. And for me, the last couple of bits, really important that we start to take the opportunity to think about how we're investing more into our VCSE sector, the person-centered approaches, and then how do we continue to use that? I call it real-time data. So we're not working retrospectively. How do we get to a point where we know what's going on across our services in North East Links effectively? So we're not waiting on a report that's a month old already before we start doing anything in advance, if that makes sense. Little roadmap slide for you. It's just kind of just to show where we are, what we've got to, very similar to what I've just spoken about. So I won't do that. I think the only bit that I would add in is that we've not really pulled together yet is developing almost a little bit of case studies for people, services, work that we've done. But we'll do that as we develop some of the outcomes and work moving forwards, and how we continue to celebrate the good work that we've done locally, think it's always easy just to get stuck in the moment. Let's celebrate some of the good findings and the work that we've done and bring that to the forefront. I think we've talked enough there. It's been kind of 35 minutes. Is there any kind of reflections or questions for anybody at that stage? Happy to take them. I'll stop sharing it so I can see people, because I feel like I've just been talking to myself for 15 minutes there. Hi, Sharon.
Hi, I'll kick it off for you, Adam. Yeah, in terms of opportunities for workforce, there's lots of opportunities for you to support the workforce via the HCP People and Skills Pledge, and I've put it in the chat. There's up and coming funding updates regarding what we can utilise the apprenticeship levy for. So from April 26, we can utilise the growth and skills levy for digital and AI opportunities to upskill staff. And there's lots of other, I can go into more detail offline with you, but there's lots of other opportunities that we can potentially link into this as well, and to support the workforce. But we can do that offline.
Yeah, no, it'd be great. Yeah, absolutely. I think there's ways in which we can do all of that. I think it's an opportunity for us to recognise if there's any gaps in support or training or skills for people as we develop it as well. So yeah.
Yeah, and there's resource there. So it's back to that sharing of the resource and all coordinating and collaborating together.
Great, thanks, Sharon. Amy?
Adam, I just wanted to acknowledge that there's been some comments in the chat, and I can see Sarah's replied back to Darren. Obviously, Sharon's just spoken there. But yeah, there was some talk about the dashboards and looking at partnerships and relationships at a local level, and Sarah's replied there. So I just wanted you to know, I know you was busy talking, but Sarah has acknowledged those comments in the chat as well.
Yeah, so there's no other questions from the chat there that I need to worry about. I've just had a quick scan. No, is there any other questions from anybody else on the call? Hi, Jill.
Can I ask, is this across party political? When the government changes, will all of this change, or is this going to stay in place?
Very good question. Do I say no idea? This seems a plan in place as a piece of work for us that will be running until it was a 12-month, initially a 12-month, they said pilot, but a 12-month piece of work that we do across our places. It doesn't feel like there's any sort of push to change anything at all. But if there is a change in party, then will it change something? I guess that's a watch this space, Jill, to be honest.
Thank you. I just thought I'd ask that because we all get excited about these things and then poof.
I think there's some of the work that, if it was to change, that actually would be essential for us in terms of how we work together anyway, from an integration perspective, that just seemed the right thing to do.
Definitely, yeah. Okay,
yeah,
thanks.
Yeah. Any more? If not, I'm going to ask and if I can pinch just 10 minutes to pick people's brains, Amy, if that's all right. Yeah.
Absolutely, Adam. Yeah, go for it.
Yeah. If there isn't any other questions, then what I'm going to do is just quickly share those slides again. So as you've heard us talking throughout the presentation, that one of the development areas for us to look at is around neighbourhood health centres, and I would really like to get your thoughts. And has that come back up?
You've got reflections and